Hi, I'm Dr. Iresh Shetty. I am a consultant cardiothoracic and vascular surgeon at KMC Hospital, Mangalore. Hole in the heart is a common terminology that we would have heard from our childhood days. It is basically a defect in the wall of the heart. So there are four chambers in the heart, and the four chambers are separated by two walls. So depending upon which wall is affected, the disease can be called as an ASD or an atrial septal defect, or a VSD or a ventricular septal defect. Both these basically mean there is a hole or a defect in the wall of the heart. So if a patient has an ASD or a VSD, most commonly it is detected in the childhood stage itself. Sometimes during when the child is still in utero, that is during pregnancy, or immediately after birth. So when it is found out, then depending upon the size and the symptoms of the patient, we decide the treatment for the same. The symptoms that commonly occur with such patients at a young age group especially are something called as recurrent respiratory tract infections, especially pneumonia, requiring hospitalization for the same. If this is commonly seen in young age group children where they have repeated hospital admissions for pneumonia, they will require further treatment for this hole. Following that, certain times they will not have any symptoms at a young age group but develop it at a later age group, maybe in their teenage, adolescence or adult, and depending upon their symptoms they will have to be again treated for the same. Symptoms being either easy fatigability or tiredness, some breathlessness, and of course again repeated recurrent respiratory tract infections or pneumonia. If in case the patients have these symptoms, we can treat these patients either by something called as a device closure or an open heart surgery or a minimal invasive cardiac surgery. So the device closure can be decided depending upon the size of the defect. If the size of the defect is not too big, then it can be closed with a device or a button which can be inserted by a simple needle in the thigh. But if a patient undergoes a device closure, for the rest of his life he requires certain medications to maintain this device within his heart. If at all the defect or the hole in the heart is too big and is not amenable for device closure, then the patient undergoes open heart or minimally invasive cardiac surgery for the same, in which case this hole is closed by an artificial material which could be either part of the patient's own body, which is called a pericardium, or a patch or an artificial patch that is procured from outside. If in case the patient undergoes an open cardiac surgery or a minimally invasive cardiac surgery for the hole in the heart, they may not require any medications for the rest of their lives to maintain this, and it has a very good success rate and is more preferred than a device closure.